Hello, my name is Dr. Prasad Raj Dandekar. I am the head of Radiation Oncology at Sir H. and Reliance Foundation Hospital. Radiotherapy forms a very important treatment for cancer patients. Almost 60 to 70% of the cancer patients will need radiation at some point in their journey. Now in radiation, we are using very high energy X-rays to focus onto the tumor. But while doing that, we have to make sure that we protect the surrounding structures. Now we have the best of the technology to do this, such as ETHOS Adaptive Radiotherapy. We are able to do adaptive radiation, surface guided radiation, radiosurgery, VMAT, IMRT, and all lots of treatment techniques. But what is important here is patient safety. While you have the best of the technology to give to the patient, is it safe? And how do we do that? Now, we run a very extensive quality assurance program, or the QA program, to ensure that the treatment that we deliver is safe for the patient. And the QA starts every day. Every day when my team comes into the hospital, the first thing that they do is they do a quality assurance test for the machine. Now, the QA tests are done every day. There are certain tests which are done every week. There are certain tests which are done once in a month. And then there are certain tests which are done every 3 monthly. All of this data is very strictly monitored to make sure that the machine is performing at its best and there is no problem wherever. And if there is an issue that we notice, we immediately correct it and we put a hold on to the patient's treatment. Now this is for the machine. That is the machine working perfectly. When we come to the patient's treatment, every patient's radiation plan that we make, we get a quality assurance test done on that plan. So what we do is we set up a dummy patient onto the machine, deliver that treatment, and then measure what happened. So we know precisely what is going to happen in our patient's body, and our tolerance is at above 98%. So every time the patient receives the treatment has to be perfect. So this is very important to make sure that not only the radiation is effective, but it is also safe for the patient. Now when we talk about the most advanced radiation technique, which is adaptive radiotherapy, there we go one step forward. Not only we do the daily treatment QA for the machine, and not only we do the patient specific quality assurance test before we start the treatment, but in adaptive we do a quality assurance test on a machine called as Mobius every single day. So this is as good as it gets when it comes to patient safety. Our aim is to deliver the most precise treatment for the patient for the best cancer cure, but also the most safe treatment for our patients, because we want that the patient gets the best. So radiotherapy needs to be precise but also safe.